And today we're going to talk all about receding gums, gum recession, the causes, the treatment, and everything you need to know to be better informed and make better decisions about your health. So what is gum recession? Receding gums is when your gums start to pull away or recede from your tooth, and it can sometimes expose the root of your tooth, which can be sensitive and painful and ultimately just really annoying. And some people definitely feel the pain and sensitivity and problems that occur when you have these receding gums. So why is receding gums bad? When the root surface is exposed, this is not as strong as your enamel, the white part of your teeth that you see when you smile, and it's more susceptible to getting cavities or to just wearing away. And if you wear away your tooth too much, this is definitely not good, and it can cause major problems later on in your life. For example, if your receding gums get really bad, you can develop black triangles in your teeth. Ultimately, it's harder to keep your teeth healthy and cavity free for a long time. So what causes gum recession? Well, one of the main causes of gum recession is having severe periodontal disease. This can happen when you have calculus under your gums and your gums get really inflamed, which can cause a destruction of the bone and tissue around your teeth. And if you don't get it cleaned early enough, then this will advance the disease and you will start to have severe gum recession. Another major cause of gum recession is brushing your teeth the wrong way. So when you're brushing your teeth, a lot of people don't realize that number one, you have to change out your toothbrush head or toothbrush if you're using a manual toothbrush every 3 months so that you're not using hard bristles and that your gums are protected. Hard bristle toothbrushes are actually very damaging to your gums, and I encourage anyone who is using a hard bristled toothbrush to consider using a soft bristled one today if you can. And the last thing I should mention about brushing your teeth is that you don't want to brush too aggressively. Some people out there are heavy-handed, including myself when I was younger. And when you brush too hard with too much force, that can also be a cause of gum recession. Now, there are solutions when choosing the right toothbrush for you that will help stop or prevent gum recession, and I'll talk about that when I go over the treatment towards the end of the video. Grinding or clenching or having an inadequate occlusion or bite can also cause major recession. In fact, grinding can cause a litany of other problems, including wearing your teeth, jaw pain, or even breaking your teeth. So you definitely want to try to control that habit. And another major cause that a lot of people don't think about is wearing maybe an ill-fitted partial or a partial that is rubbing on the gums a certain way. If it's too tight, or it's too irritating on the gums, your gums can and will start to recede a little bit. So you want to make sure that the partial is well fitted as well. Okay, so what are the treatment options for gum recession or receding gum? Well, the type of treatment depends on the cause. Let's start with periodontal disease. Like I said before, when you have periodontal disease, you're losing a lot of bone actively. And the longer you wait, when your gums become healthy, they will recede to the level of where the bone is. So if you lose a lot of bone, lots of bone, and then eventually you get your deep cleaning and you start to get healthy again, your gums will recede at a much more aggressive rate than if you go to your dentist or your hygienist and you get the cleaning done immediately. And that's why I encourage people who maybe haven't seen a dentist in a long time to go and get them cleaned early, because if you wait too long, the problems associated with gum recession can be more annoying than it has to be. Now, if you have a little bit of recession and you're having some sensitivity associated with that recession, number one, do nothing and just try to maintain that recession. But number two, sometimes you can place a dental filling along the gum line to protect that part of the tooth from wearing more in the future, and also protect that tooth from being sensitive. Now, in severe cases, when you have major gum recession, then you need to consider getting a gum graft surgery. In some surgeries, they take a section of your palate and they graft it to where the gum recession is, and it's been proven as very effective. And typically in those cases, you're gonna go to a periodontist. Sometimes the periodontist will do a pinhole surgery technique, which is also incredibly effective. And I'll definitely link out a video to another YouTuber who's a periodontist who explains this procedure really well. And finally, how can we prevent gum recession? So number one is gonna be doing really good oral hygiene. That means brushing your teeth twice a day, making sure you're flossing, and going to your 6-month cleaning intervals to get your teeth professionally cleaned with a hygienist. They have special tools that will help remove that calculus, minimize the inflammation, and prevent any future gum recession. If you are brushing too hard, you wanna get the right electric toothbrush. There are toothbrushes out there on the market that have an indicator light that tells you if you're brushing too hard. And this is something that I actually bought around 10 years ago because I had gum recession on my back teeth because I was brushing too aggressively. And it trained me to not brush so hard, brush a little bit lighter, and that was effective at stopping my gum recession. Now, if you're grinding your teeth, you want to consider wearing a night guard. A night guard is a plastic appliance that you wear at night to prevent your teeth from grinding together, and that's a really good way to prevent your teeth from wearing down and also to prevent gum recession. And finally, if you have gum recession, I can't encourage you guys enough, but go see your local dentist, someone that you trust, to give you different options and solutions for the gum recession. If you're treating sensitivity, there are solutions out there. If you don't like the black triangles, there are solutions out there. If you just want to protect those spots and cover it up, there are solutions. So go to your dentist, get diagnosed, and I think that's going to be really helpful. I want to thank you guys for watching this video. I hope it was helpful. Be sure to like it down below, subscribe to the channel, leave a comment if you have any questions, and I'll definitely see you for the next one. Thank you.